Well, new laws banning abortion took effect in 4 more Republican-led states on Thursday. Millions of women will now lose access to abortion in Idaho, Oklahoma, Tennessee, and Texas. Meanwhile, North Dakota's trigger law is scheduled to take effect on Friday. For more, I'm joined by Elizabeth Nash. She's the Principal Policy Associate for State Issues at the Guttmacher Institute. It's a research and policy organization that focuses on sexual and reproductive health and rights. Thanks for joining us. 13 states have passed these so-called trigger laws. What do these new restrictions actually change?
Well, what they do is they keep clinics from being able to provide abortions to people who need them, right? So we are seeing across the country, state after state, implement these abortion bans, and that means that the clinics cannot provide care. And so as the number of clinics is shrinking, the distances are essentially increasing for patients who need care because they have to travel, and they're going to have to travel hundreds of miles. So, for example, Louisiana, if somebody in Louisiana is looking to access abortion care, they're probably going to end up in Illinois. That's a well over 1,000-mile trip, round trip for that person. And we know that 75% of abortion patients are low income. They're disproportionately Black and brown patients, and 60% of patients have a child already. What all of that really boils down to is that it's incredibly difficult for patients to travel. An average abortion costs about $550. That's a lot of money to pull together in a short amount of time. And then imagine adding a 1,000-mile trip on top of that, along with childcare.
And time off from work, childcare, all of those things. A federal judge paused a portion of an Idaho abortion ban. It was set to go into effect on Thursday. Could we see similar challenges in other states?
Yes, we could. But the thing is that what we saw in Idaho was really about the exceptions, right? There's still a ban in place, but there are now some leeway for very ill patients to get care. But that doesn't mean that most people would be able to access abortion services. So what we're seeing across the country, right, are as these abortion bans go into effect, and we have them in effect primarily in the South, the Plains, and the Midwest, that you can't just go across one state to get an abortion. You're traveling so far. And these wait times at abortion clinics are increasing. They have been increasing for the past several months, right? So you're looking at, if you call a clinic, the next available appointment might be in 4 weeks or 3 weeks. Those weeks are critical in trying to get to an abortion clinic.
Unintended consequences. We talked about all of the people traveling to states where abortion is still legal, the high cost of that. Another unintended consequence of the abortion ban in several states is its impact on in vitro fertilization and surrogacy. That has made it a lot more difficult in these states for couples that have had trouble conceiving a child to actually do it with an in vitro. That's an unintended consequence. What else, along with that, do you think we could see in the coming days and weeks?
Well, what we have been seeing is the fact that these exceptions are really in name only, right? We saw that in Ohio, where, getting an abortion for that young girl was very, very difficult. That person had to go to Indiana. And what we've seen around ectopic pregnancy, people who needed treatment for ectopic pregnancy, which is exceedingly dangerous if not treated, someone could die, that they haven't been able to get care in some places because providers are afraid that they would be in violation of these abortion bans. So we're seeing health care being impacted beyond abortion. Impacted beyond
abortion. In the meantime, while all these legal challenges are going through, what is the next urgent legal battle coming?
Yes. So, right now we have cases in about 15 states. In some of those states, the bans are in effect. And in some of those states, these courts have blocked enforcement of the bans. In states like Utah and Wyoming, for example. We are waiting for those cases to move through the legal system, and we don't know. Some of them may be successful in striking down these bans, but not all of them. So we're anticipating more states to have bans soon, but also we're anticipating special sessions in some states. Like South Carolina has been moving a total abortion ban, and now they're getting a special session together so that they can pass it. And then in January, we're anticipating these legislatures to come back into a session, and even in states where there are abortion bans on the books, pass more restrictions on abortion to make it even harder to get care, even out of state.
It is a long legal road ahead. Elizabeth Nash, thank you for joining us.
Thank you.